The uterus grows from 4 ounces to 2 pounds of muscle. So 2 pounds of muscle. Blood volume expands from, 1/3 to 30 to 50% more blood in your body. Whoa. The baby is going to be on average, let's just say, 7.5 pounds, even though some babies might be 10, others might be 6 or whatever. But, there's the baby. And then there's just supporting the organ health, right? The organs are always rebuilding themselves, and the liver and the kidneys are especially important to that process. And so they also need amino acids, right, to rebuild cell growth and all that. So there's all this happening. How can that happen when you're not gaining any weight? Like, unless somebody is burning some of their own body to make that happen, if they're not putting enough in to really be gaining some weight. I mean, there's like a minimum, some people might only gain 15 pounds. 15 pounds, I think, is kind of like the minimum that, but then you have the whole issue of, are you planning to breastfeed your baby? Because if you are, having some fat on your body is really essential for that fat metabolism and getting through that process. So in any case, to me, I see it as a pillar, but I was also raised that way. So I'd go be with my grandma, and she would teach me how to cook and stuff. I learned some basic cooking from her, and this is kind of about what I think I did a good job with my kids. It's sort of a transition, but so from really young ages, I got them involved with, I had big bowls, and we did cooking together, and so all my kids love food and they love cooking, and I think that's a really important thing. And it's one of the things that we talked about before we got started of, like a foundational thing to become a parent. I really think understanding food and being able to prepare healthy food and, being willing to take the time to do that. I mean, it's still in my life. I probably spend at least 2 hours of cooking almost every day now that my daughter's living with me. I kind of had a way when I was living by myself where I could make food for a couple days, but I'm not a big believer in batch cooking because I learned from a friend who's an Ayurvedic coach that it's better to eat your food fresh, like ideally within 24 hours. So I just end up doing a bunch of cooking every day, and just so I can feel healthy and keep going to people's births and having my life work that way. So.
And then you had kids later, correct?
Just one. So I had my third one. I was 26 here in Williams. And I didn't think I was going to have any more, but then 8 years later, I had one more. So.
What was the difference? Because I've had this thought, and it's kind of shifting. Yeah. Like, I want to have kids young so I can be kids with my kids, and then I can be young and do the whole thing with them. Right. And then there's this other side of me that's like, maybe you should become financially established and like really build a really good relationship with your partner and then have kids more in your 30s.
Yeah.
What was the difference there for you?
I mean, I think that having a really good established relationship with your partner is key, because not to say that you have to be in your 30s when you have your kids, but I do think having a good foundation, I know that's not always how it works out. I mean, sometimes people fall in love and maybe have a kid soon.
We're good at making kids.
But I do think taking the time to create a foundation. I mean, if you think about like building a house, if you build your house with no foundation, then the more stress that comes in, and stress isn't always a negative thing, but raising kids brings with it a lot of challenge. It's so when you think about the aspects, the challenge for the relationship, having a strong foundation of love and understanding, but then also ability to communicate, especially hard things, how to talk about challenges. And I think also the other aspects is, we all may have whatever wounds we carry. I mean, as much as our parents love us and do their best, there's stuff that we're working through, and we can end up really projecting that onto our partner when we're under stress versus like recognizing like, why am I feeling this way? And what does this remind me of? Like, how can I work through this? And so I think some of it is just creating something that you can hopefully sustain over the whole time of raising your kids. So some of the big questions are sleep. Yes, it was easier to miss sleep when I was younger. Certainly when I was 20, I hardly noticed it. My family who decided to have kids older, it's been very challenging. My daughter-in-law who's 35, my son who's 40, when they had their first kid, it's been really hard to get through that. And my other daughter, she's 31 when she had her first one, or her only one so far, but that missed sleep can be really hard. And so finding kind of the balance in there of, how do I want to navigate that early time? Some people have the resources to have like a night nanny or whatever. One of my nephew and his wife, that's what they did to get through that time. So I think that's part of it. But I also think, if your focus is finding someone that you can start a family with and such, and finding someone that you want to do that with, if you maybe start earlier, then maybe by the time you've got that foundation set, you could be ready to have kids and make that choice. Because
there's this funny, from my understanding, for a woman, like ideally biologically they'd have kids like in their early 20s. Is that a correct statement?
I think that with the way the bones of the body works, having your first baby by 25 is good. But I think that in terms of the biological clock, that the other stuff I was mentioning earlier about the study of longevity from the perspective of preconception, and how to kind of create a lifestyle where there's certain kind of preparation that you're doing every year, especially some type of detoxification. There's different ways of doing that. You can actually change the kind of biological age of the female body, and that's kind of the work of this one doctor that I was mentioning earlier, before we started the cameras. But so I don't think you absolutely have to have your kids in early 20s. I do think that doing some preconception planning, and both from a perspective of your life and what kind of foundation you want to create with your partner, but also from the perspective of detoxifying, because even living in Williams, where would you have cleaner air and such, there's still so many toxins. Like in studies on babies, like all of the toxins that they study, they're finding in babies. So, or all the ones that they
are finding in people or finding in babies.
Yeah, they basically, so doing some type of preconception preparation, which can involve kind of all levels. Like this doctor believes it involves all levels, from the psychological, to the biological, to also community, and also, what other stresses you might be in with different races and different gender identities and stuff. Sometimes just those additional stresses can cause more. So just trying to look at all of those layers and prepare yourself the best that you can.
Could we explore those, the pillar that you kind of laid out, like psychological, community, and then physical? But first, could I get could you give me what you've been doing for a lot of your life, because I know you and I know what you do, but what's your profession?
So I started studying midwifery when I believe I was 23. I didn't realize I was newly pregnant with my second child, but I was, just didn't even know I was pregnant yet with my second child.
Why study that?
Well, I mean, my grandmother had been a community midwife in her community. They lived in a predominantly Protestant community, and they were Catholic, so there were some challenges for them living there that my mom have talked about. But she was kind of the person that you would call if you needed help. Different than what I learned, but still someone who was experienced.
Yep.
And then my I don't know that there was an experienced person like herself that she could call. So my grandfather, basically, they had unassisted births back then. I guess it'd be called free births now, because the doctor who attended births at that time, my grandmother didn't really trust him. So I just grew up hearing kind of that overview. I didn't hear too many stories in depth. My grandmother had given, she'd been pregnant at least 12 times.
Wow.
I didn't get to talk to her about this before she died, but by the time I was kind of doing the math, I knew of 10 of those kids. I don't know what happened. Wow. They had lived in kind of 2 different communities. And so I just kind of associated midwifery with normal birth, even though my mom had us in the hospital. And I was born in a hospital. So when I was pregnant with my first, I didn't really make a decision until I was probably even 6 months pregnant about what I was going to do, like where I was going to have the baby. And I was a really, really active kid, and I, would go to the emergency room because I mostly cut things. I didn't really break anything until I became an adult, but I had to have things stitched up and whatnot. So to me, it's kind of thinking of the hospital. I thought, well, the hospital's where I go if I need help with like that kind. Is that really where I want to have a baby? So I ended up having my first baby at home, and that was a pretty foundational experience for me. And I hadn't really fully decided what I wanted to do with my life. I mean, I was really interested in, like I said, gardening and farming. I had been studying chemistry and biology in school, but I didn't end up graduating. Because I had my first kid while I was still in school, and I never quite, even though I went back, I didn't end up finishing. And so I was kind of in the space of like, well, what do I want to do? And so I was actually at this baby fair with who is now my across the street neighbor, but I knew back in Santa Cruz Hollis. We were kind of walking around, and there was a woman who was offering midwifery class, like 10-week midwifery class. And so we ended up going to that together, and I ended up working with her for a couple years, the midwife, and going to some births with her over that time, kind of between, when I was early pregnant with my second, and then I was still working with her when I moved up here. Like that was the end of, when I was pregnant with my third. So that's kind of how that started. I worked with her for probably 2 to 3 years, and then when I moved up here, it was pretty hard to kind of break into the midwifery community. I didn't really know anybody, and so I ended up taking there was kind of 5 years between was it a full 5 years? I'm trying to think. Well, it was around, I moved here at 26, so I think I was 30 when I met Rion, and I kind of started studying with her and working with her. So that's kind of how I got into the midwifery community up here, was working with Rion. And so over the years, I've worked on and off with her, and kind of by 2000, I had my own practice. So I moved here in 89.
Wow.
So I did a lot of assisting and just kind of, supporting like that, but I didn't really start having my own clients until like the late 90s, and I didn't get licensed until 2006 in Oregon. So there's kind of a long, slow process to that, raising my kids and such. But yeah, I've basically been involved with birth in one capacity or another since about 1996.
Whenever you speak to clients, is it a wide array of what they're hiring you to do? Like, do some people be like, I just want you to be there for the birth, or is it like, I'm hiring you for this whole experience? Yeah,
so we operate, like licensed midwives in Oregon operate under a law. Like there's a law written up about what we can do. And so we're maternity care providers. We don't really just go to the birth. I think there was one time that I did that, but for the most part, legally, we have to kind of provide care in a certain kind of way. And for some people, it might be a little more medical and has become more medical just because of the skills and things that develop over time and what can be offered. But so basically, people can do the opposite. They can say, can I see you for prenatal care and get guidance in that way? But it's rare that, unless someone moves here at the last minute and you do some intensive prenatal care and then help them with birth, that can happen. But in general, people usually would hire you for either the whole thing or just for, some prenatal counseling and support.
Could you define prenatal?
Yeah, so it's basically, what you would get if you went to see a doctor as well. There's certain lab tests that are done just to see what certain blood values are, making sure that someone's kind of healthy enough, or if they need to kind of build up some before that. And then it's checking on for midwives, it includes like the well-being of the woman as well. Not to say that doctors don't care about that, but they don't have a lot of time, so it's pretty abbreviated. If you go to a clinic or a doctor, usually for most people it's going to be 3 to 10 minutes they spend with their doctor. And as midwives, we kind of spend on average an hour. I'd say at the beginning of care in those early visits, it can be longer, helping someone create a care plan for themselves of the way they want to approach it. And so it's basically prenatal care is everything that happens before the labor, and then the care during labor, that's intrapartum care. And then once the baby is out, then that's the postpartum period, although a lot of people associate postpartum, that word, with kind of postpartum depression, but it actually, just postpartum itself means the time after the baby's born until the midwife or doctor is done.
Thanks for defining those.
Yeah.
That's really helpful.
Yeah.
What are some of the questions that you'd ask a woman that, I guess this is getting back to the physical, the mental, and the community. What are some of the questions that you'd ask a woman that's like, I want to get pregnant and I have a good partner, I have a stable home, and like that kind of like logical groundwork is set? What kind of questions would you ask her? For me, pretty much the only people who ask me those questions are family members. Okay. So I'll have family members, because a lot of people don't reach out until they're already pregnant. But for someone who's planning to get pregnant and isn't planning to get pregnant tomorrow, even if it's a friend who talks to me about like that, ideally you'd give yourself about a year before getting pregnant, and if you're older, possibly even 2. Wow. Which sounds funny, but so that pyramid, and I can't tell you everything that's in that pyramid, because that pyramid is from Dr. Cleopatra is her name, Campervine. She does the, forget right now what her program is called, the trimester program. So it's like this idea that you're doing it before you even get pregnant. And the genius in that is that both you can create your pregnant lifestyle before you ever get pregnant, understanding the relationship between food and your body, between your mental health and your body, which is kind of the psychological part. And so for her, the base of that pyramid is psychology, so that you can really work with yourself. And to me, from my perspective, that would include just how to keep your relationship healthy when there are challenges. Like when everything is good, most people gravitate to each other because they get along, but there's also those other reasons that you get drawn to somebody, and there may be the harder stuff that you need to work through. And so to me, looking at that perspective in your relationship and creating tools that you have practice with. A lot of people will take a class or read a book and they'll have these tools and think, I can use these tools if I get into trouble. But just like a hammer or a chainsaw or some other kind of tool that we might use out here in Williams, if you don't know how to use it, even if it's in your tool shed, you're not going to be able to get it out and do something with it. So to me, that would be looking at how can I communicate better and what type of communication could I use. Then looking at what kind of toxins might be in my body. So sometimes that can involve testing. For Dr. Cleopatra with the trimester program, she kind of has this, at least when I was working with her, this 12-week program that you would complete. And the idea behind that was that the egg itself, from follicle to being ready to be fertilized, is about 120 days. So that's kind of the minimum time that you would want to give. So it's about 4 months to kind of preparation so that you can optimize the health of the egg. So that's kind of one piece of it. And from her perspective, doing that maybe 3 times for over a year period, so that you're really getting yourself into this rhythm of understanding yourself, going through her pyramid process. Not that has to be an approach to take, but for example, there used to be a naturopathic doctor who was here in the Rogue Valley who taught people how to kind of preconception cleansing. And so my daughter, who had my first grandchild, her first baby, that's kind of the approach that she took. They knew they wanted to get pregnant. They didn't have a date for when their conception, when that was going to be, but they wanted, like, what can we do to get ready?
So they did those things to get ready. And then just about the point that they were ready, Rion really encouraged me to talk them into trying out the trimester program. So they did another 4 months before they opened up their conception window, because they really believed in it enough. And her vision with that was that, you know, one of the parents who went through her program called it super babies, like this idea that you're creating your own super baby by doing all this preparation to get your life ready, to get your body ready, to get your mind ready. And from the perspective of a midwife, we oftentimes spend whatever time we have with people in the first trimester, in the first half, or sometimes even the whole second trimester, trying to help people to make lifestyle choices that are within reason for their life, to help them support a healthy pregnancy. And when you do something like that, like the trimester, or you set yourself like, okay, we know we want to get pregnant in 2 to 3 years. What are things we can do to help set up that lifestyle for ourselves? Then you can really support the optimal health of the egg and the sperm, which will really optimize the health of the baby and their growth. And then being able to care, like the first trimester itself, there's so much cell division and growth happening that the choices that you're making about food and everything at that time also can have an effect. And none of this is to make anybody feel bad about what they didn't do. Like, I didn't do any of those things. And it's more to recognize what opportunities there can be if you want them, and that you can make a difference in how that happened, you know, like how it all unfolds. And then I think setting up your life after the baby's born, and this is a more challenging thing, maybe less so if, you know, you live on land that your family owns in Williams and you can live here without a lot of worries out in the world. But if for people who have jobs, and not to say you don't have jobs, but like people who are really busy, working a lot, the world is not set up to support optimal care for babies in this country. I mean, we've gotten to the point where we're paying for 12 weeks of family leave, where in reality, having, you know, 2 to 3 years to really focus on the growth and the beginning of the life of your baby can make a really big difference in their health and their well-being in the world. And so, you know, someplace in there, having an idea, how do we want to do this? And I know there can be challenges with that too. My daughter, who had the first baby in our family, she was getting her master's in business before they opened up their conception window, and she did her final project on the impact of women in those countries where they do have like 3 years of family leave. And she found that can make a huge bad impact on their career path. You know, for her, her career is really important. And so she took her 12 weeks of family leave and was able to arrange for a lot of family support to help watch her baby. So that was kind of how she approached it. So in any case, I'm kind of a little bit all over the map with it, but I do think that putting some intention into it can really, like, setting a foundation in your life, setting a foundation in your health, setting a foundation in the knowledge that you have, how to get along with each other, how to support the health of your family overall for people who don't even really know what to do with a box of food that's given away at Rogue Unites. I mean, I don't know, you know about Rogue Unites. So like we offer that to people who have really low resources, and so many people don't really know what to do with a box. Like they're used to getting packaged things or frozen things, or, you know, where you just heat it up. And to me, that's really sad that there's this amazing free food that's available for people who have low resources for food, and yet they don't really know what to do with it. So I feel like those are the kinds of educational pieces that people could work on to really be ready to be a parent. And it may sound like a lot for someone who's really eager to have a kid right away, but
it is a lot. It's a big deal.
Yeah,
you're bringing a child into the world. It's a big one. Would you encourage the man, like you speak to this this detoxifying process, would you encourage the male partner in this relationship to go through that with the woman as well?
Absolutely.
Yeah.
Not everyone's willing to do that, and so, you know, certainly it's going to benefit even if just one person does, but if the two people do it together, it's really optimal.
Well, I could see that could also be like an emotional strengthening of the relationship too, like not just physical, but like we fasted for 7 days, or well, what's your ideal detox fight?
Hope that Dr. Cleopatra writes a book. She was supposedly going to write a book. I do think that I personally have not put any research into that at all, and I've only taken information from other people. There's a lot of people who offer that guidance out there, and I think what Dr. Cleopatra is offering is really great, but I'm not exactly sure what it is right now. But her thing is, it's she calls it the nutritional, it's kind of the nutritional gifts. It's like looking at food, and so you kind of, I think in the weeks of those 12 weeks, it might be like 3 or 4 of them, and you can make a choice how deeply you want to go into the cleanse process. For people who are already pregnant, you don't want to do that part at all, but you can make changes to your diet that support more optimal health. So there was guidance with that, but I can't really offer too much information. I do think basic things are just looking at inflammatory foods. Each person might have different response to certain kinds of foods. So whenever we have increased inflammation in our body, it just makes everything else harder to work properly. So certainly having awareness in that. But I do think getting some guidance, and there's so many doctors and people and things that are out there. I've been recently studying some of the work of Dr. Mindy Pelz, and she has a big presence on YouTube, and she's written certain books. One book called How to Fast Like a Girl, and that has information actually for both men and women about how to look at changes in your diet to support optimal hormonal health. So I think that's a resource that's pretty easy to access.
I've heard that whole like fasting thing, as a lot of those studies have been done predominantly on men.
Well, she's been, I think I've only recently heard about her, but I think she's been doing this kind of in a larger community, online community for about 20 years. And so she has a lot of research based on that. But I think intermittent fasting, and she has a lot of information on eating for your hormones, which I think can be really, really beneficial for optimizing, because for men, there's just the one main hormone, testosterone, and I think the testosterone creates, I mean, I've listened to her books. I need to actually read them too, so I could speak specifically to things. But for women, there's like 3 or 4 main hormones that affect how the cycle goes, and so she has recommendations around intermittent fasting in certain periods that can help with detoxification and cleansing and autophagy, where the cells are kind of cleaning themselves up based on how long the fasting is, and she leads groups in that too. And but I do think it's worth putting some time into looking at that and exploring it and kind of experimenting with it. I think early on in my career, there was, we were kind of more in that, well, we're telling you how to do it and follow this diet and do that. And, that kind of went out the window because it doesn't really work. It's not, we don't want to be the authority telling people what to do. We want to see, like, how do you eat now? And what kind of small changes might you be willing to make?
Yeah, how do you navigate that? Because it feels like someone would come, like if someone were to come to you and be like, I want to get pregnant, this is my lifestyle, and you're like, ooh. Like, how do you gently encourage someone?
I mean, if somebody's coming to you ahead of time, they're usually more willing to do stuff. So it's kind of a little more challenging to work with people, even younger people, because there's a lot of kind of people are established with the way they eat and what they eat and how much they eat, and don't really understand the connection between food and what happens in your body. Because I think when you're younger, depending on the foundational health you started with, you might not notice much response in your body to how you're eating until inflammation builds up and things like that. So kind of how I do it for people who have already come to me is I just, if somebody's coming to me saying they're having problems already, which sometimes happens, I'm having headaches or this or that, then I kind of just like, well, let's take a look, what are you eating in the day? And usually you can see what the root is of what they're experiencing and how they might shift that to feel better. You know, for some people, they might just not be drinking much water, which in pregnancy is pretty hard, you know. So for somebody, if someone came to me ahead of time, I would say, you know, there's a resource called Real Food in Pregnancy. It's she's a registered dietitian, kind of the leading person in nutrition in pregnancy. She came to it from the perspective of gestational diabetes first, and that's a whole offshoot. But I'd probably say, why don't you check that book out? I'd probably say check out, you know, Mindy Pelz's book, Fast Like a Girl, even though it sounds kind of funny, like I'm not wanting you to learn about fasting from that perspective, but I think eating for your hormones is a really wise thing if you're working on getting pregnant. You know, if Dr. Cleopatra writes a book, then I would recommend that one too. Although I do think she, does have, anyway, because I feel like a lot of the information that she has is based on science, like solid science, because she works at USC. She's a tenured professor in the, you know, longevity department. So there's a lot of information out there, but you know, that for me, that's kind of the start. I feel like sleep, nutrition, and kind of mental health, and however you want to see your spiritual side, I think that's important too, definitely. But I feel like for each person that's individual, but you can kind of work with, are you sleeping, are you eating, you know, and how are you feeling overall, emotionally and integrated with childhood, and you know, I don't know, that's a big one, but finding ways to kind of work with yourself in all of those areas to prepare.
That's fascinating. I almost want to make an assumption, but I'm just going to ask you the question. Do they go over these, call it these 3 pillars whenever you go to your doctor? Like your typical white lab coat doctor?
Yeah, I mean, they don't have enough time, and they don't really have, so before we got started with the, you know, doing our interview, we were talking about nutrition from the perspective of health and pregnancy. And so, you know, in medical school, still for the most part, I think they really possibly even only offer one class in nutrition. So although some doctors are branching out into that, it's becoming more of a thing to some degree, it's still a small thing. So they kind of tell you what not to eat. Don't eat, you know, certain things that could cause problems in pregnancy. But aside from that, there really isn't, I mean, certainly, they probably ask how you're sleeping, but I don't really know what they do to, since I've only been to a few doctor visits, I mean, maybe 10 or something with different clients over the years. But I know they don't have a whole lot of time to talk about it. So they're basically monitoring what is the growth of the baby. Is the baby growing normally? And most, from the kind of the Western medical perspective, most things are dealt with, you know, if you're having symptoms of something, they're treating the symptoms. If it gets to the point where the pregnancy can no longer be supported, then they're inducing the baby or monitoring in the hospital till it's safe for the baby to be born. You know, I think each midwife looks at it differently as well. I mean, recently, the main clients I've been taking care of, I have a pretty small primary practice myself where I'm seeing clients where I'm their primary midwife. And all of them were kind of light eaters for different reasons. And so I ended up talking to a few different midwife friends about it. And, you know, it's like there isn't a big, strong foundation of nutrition in a lot of people's training as a midwife either, you know? So it just kind of depends on what your perspective is. Plus that idea that, you know, access to food is privilege. And I do think that is true. However, where we live, it's so accessible. Like, to me, it seems like in this valley, there's so much food being grown, so much access to it that I don't necessarily think of it as privilege, since it's available to almost anybody who wants it. So,
So what I kind of hear you saying is that a lot of doctors won't even say you should be eating X, Y, and Z because they could get labeled of like, oh.
Well, I don't know that I would say they could get labeled, but I do think that most people, unless they were raised or have studied it themselves don't have a lot of knowledge about how food affects the body. You know, I mean, they'll probably say like eat protein and make sure you're getting the basic, you know, macros and stuff, but there's not a lot of guidance around that. And I don't think people even really think of like, well, where is, you know, for example, like one of the issues that I was having with a client was she just really wasn't gaining weight. Like she had lost weight in her first trimester, which for some people can be common. And then she still hadn't, like she was more than halfway through the pregnancy and she still hadn't gotten to her pre-pregnant weight. You know, it's like, well, where do you, it's like you're growing muscle, right? You're growing, like the uterus grows from 4 ounces to 2 pounds of muscle. So 2 pounds of muscle. Blood volume expands from, you know, 1/3 to 30 to 50% more blood in your body. The baby is going to be on average, let's just say, you know, 7.5 pounds, even though some babies might be 10, others might be 6 or whatever. But, you know, there's the baby. And then there's just supporting the organ health, right? The, you know, organs are always rebuilding themselves, and the liver and the kidneys are especially important to that process. And so they also need amino acids, right, to rebuild cell growth and all that. So there's all this happening. How can that happen when you're not gaining any weight? Like, unless somebody is burning some of their own body to make that happen, if they're not putting enough in to really be gaining some weight. I mean, there's like a minimum, you know, some people might only gain 15 pounds. 15 pounds, I think, is kind of like the minimum that, you know, but then you have the whole issue of, are you planning to breastfeed your baby? Because if you are, having some fat on your body is really essential for that fat metabolism and getting through that process. So in any case, to me, I see it as a pillar, but I was also raised that way. So, you know, and then in my own, with my own body, because I've had certain types of inflammation and problems that developed at different times. And so it's like always been a study. I've been interested in studying it really, honestly, from even when I was a teen. My mom would have different books about health and stuff. And it's always been an interest for me. So, you know, so I've been able to experiment. How do I feel when I eat this? How do I feel when I eat that? How do I feel when I get enough during the day? Or, you know, how do I feel like as a midwife? Sometimes when I had really busy weeks, I'd get a headache on Friday. Like, why am I getting a headache on Friday? Like, what happened, you know, during the week? Oh, wow, I missed lunches, or I didn't, you know, I didn't make healthy choices. I didn't have enough food with me, you know, when I was at someone's house for 24 hours and stuff, you know. So to me, I noticed like my body feels better when I eat in ways that support me to feel healthy. But I think a lot of people my age who maybe don't live in Williams, I don't know, are just expect, oh, I have to be on these medications now, or it's just normal that, you know, I'm going to feel bad by the time I get into my late 50s or 60s or 70s or whatever. And, you know, it's like I didn't want to just accept that. I didn't want to just believe that, oh, I'm going to feel bad, I'm not going to be able to hike anymore, or this or that. Like I wanted to understand how my body worked and experiment with it like that. So to me, that's kind of how I work with my clients when they come in and say I'm having headaches or these different things, I'm not sleeping at night. And they're things I also learned from other midwives who helped me when I was pregnant, you know. I mean, if you wake up in the middle of the night, you can't get back to sleep. A lot of people are like, yeah, I just can't sleep. It's like, well, in pregnancy, your body's working all night. So if you're waking up and you can't sleep, eating is, you gotta eat, you know. And most people are like, whoa, I never eat during the night. Like, really? I have to eat in the night? And sometimes people will fight it. And then once they start eating during the night, they're like, wow, okay, that makes sense, you know? So to me, that's kind of how to work with it. But I feel like as a broader culture, we don't necessarily have a connection to, if my body's feeling this way, what can I do differently rather than take this medicine? Or not to say that medicines aren't helpful or herbs aren't helpful, but to me it's like the step one would be, what about your foundational health? Step two would be, how can you support yourself as you're making changes to, you know, with a medication or an herb or something like that.
I had a friend ask me, what herbs could I take for my energy levels? They're like, you seem like a pretty energetic person. What herbs do you take? I'm like, sleep, good food. Like, because I knew what they're feeding their body, and I'm like, I'm not gonna give you nothing. You gotta address. I didn't do sugar for a month, and I noticed the first time I ate sugar, it was really hard to wake up. That was the thing I noticed. My body was just like, Like there's something in it where it like dumbs you down and doesn't make you get up and be excited. Why do you think that so many people have that mindset on like, oh, this is just how it is? Like whenever I'm 60, I'm going to feel like crap.
I mean, I kind of think that's the way that our culture believes, I think, you know. I mean, I started developing arthritis when I was 40. And I was like, no, I'm not going to do this. Like, you know, because it turns out I had this autoimmune disorder that kind of got diagnosed around that time. And so I got some guidance, like, stop eating this, try not eating that. These things are more inflammatory, just see, you know. And so that, I mean, I already kind of was into eating health, but I hadn't really thought about how food choices could make a difference. I thought, well, if you're eating healthy food in general, because I mean, I spent a chunk of time being a vegan, which I don't think was the right thing for me. And I think can be pretty hard to be healthy, especially in pregnancy. I just thought, oh, if I'm making healthy food choices, doesn't really matter if I'm not eating meat or things like that. So I think, you know, I think whatever kind of diet that you have, it's important to really tune into things like that. Do I wake up with energy? You know, am I falling asleep okay? Am I waking up in the middle of the night? How could that relate to what I'm putting in my body? But I feel like our lifestyle can be super distracting. I mean, you go anywhere and, you know, it's like everybody's on their phone and, you know, it just, and I feel like work demands in the US are stronger, like people, you know, working long hours and not necessarily having a healthy work-life balance. It makes it harder to spend time cooking and taking care of yourself if, you know, your energy is always out there taking care of something out there. So I think that's part of it. And then I don't know if you watch TV and such. I mean, you know, there's certain times of day and night, certain programs. It's just all like one medication after the next. You know, I mean, I had many years of not watching TV, and then when I started taking care of my mom, it was like, whoa, wow. You know, it's like, there's all these medications, and then there's all these side effects. But the people you see on the screen, they're happy, they're smiling, their life is better, you know. And so I had some situation recently, in the last couple of years, where, you know, because I'm 62, I just turned 62, and someone was like, oh, you're not on any medications, like, and I was like, no, not any medications. But I think that's unusual for my age, you know, I guess, since I don't mostly care for people of that age. My mom also was on very few medications, like thyroid medication. And so, but I think it can be, it doesn't have to be that way, but maybe the change that's required in order to make that happen is bigger than maybe some people are willing to do, unless it's something really life-threatening, you know. Which is why I think it's so important foundationally when you're thinking like, I want to have a family, you know, it's like you have a strong foundation growing up in a farm, food farm, and, you know, raising animals and all of that. You've got that strong foundation. And so building that strong foundation with whoever you get together with, and hopefully that person maybe will also have that kind of foundation, which will make it easier, you know, to really understand the importance of that and valuing that.
You brought up a piece that I didn't, a lot of these pieces I hadn't really thought about. I guess I'm a 22-year-old man and in my own world here. Breastfeeding, how is it different if you wanted to breastfeed your kid? What different practices would you do?
So, you know, I've spent the last 3 months, or probably 4 months, kind of being the primary support person of someone who had a baby and is breastfeeding. And so, you know, the first 6 months-ish of a baby's life, that's primarily what they're getting if you plan that you're going to breastfeed. And so, you know, having access to food and willingness to prepare food, and I feel like this is true in late pregnancy as well. Like, I teach the clients I work with kind of that there's this entity we call mama baby. And, you know, there's you, Wally, there's whoever is that partner, and then if they're pregnant, there's also mama baby, because mama baby needs to get fed, right? We're not going to just be like not feed them. However, the pregnant person might not feel like eating, And they might not feel like doing all the cooking and such. And so I think recognizing that offering food and having food available and cooking good food is really important. So that's been primarily what I've been doing when I'm at home the last 3 months, is like, you know, cooking breakfast and dinner and really supporting a healthy start for this mom and baby. Because I really believe that it's like that's the foundation for this baby's life, not just the pregnancy, but also their early childhood. And so, you know, I think the resources that you support them to grow in their early childhood can really make a difference in the health in their life and all that.
Are you an advocate for breastfeeding your child?
I think it's easier in a lot of ways to breastfeed versus to have to do something else. But I think it's an individual choice. But I definitely support people who want to do that and encourage and help them to make that happen. And I think as the partner of somebody and as a family and community member, that, you know, really supporting people to have as much support as possible in these early months can really be helpful. So in terms of, you know, breastfeeding, there's a lot of information and support out there, but, you know, some people have certain kinds of barriers. It could be just the anatomy of their breast and nipple and how that works. But I think more than that, like a lot of those things can be addressed with really good support, is making sure that they have adequate nutrition and sleep and, you know, support to make it happen. And breastfeeding just takes a lot of time. So I think, you know, I have someone that I know in my life who, you know, they have a breastfeeding area at her job. She had to go back to work at 12 weeks. But the breastfeeding, like the family room is a 10-minute walk to go to this room from where her office is. And she's in a, you know, kind of like communal office space. It's not like she has a private space where she could do it in her office. So she only pumps once a day, and it's really not optimal for her to be able to keep her, you know, she's only at work right now 2 days a week, but they want her to go 3 days a week. Her child is like 7 months now, and so it's been really a struggle for her. So that's another thing I think with working, like there needs to be close access so that someone, because ideally they'd be able to pump like every 3 hours. And, you know, so for her, she just can't fit it into her schedule with the pressure of work and things like that. So I think it's having support at work if somebody's going to go back to work, so that they can pump adequately to keep their supply going, so that these first 6 months to, you know, 2 years, I think is what the American Pediatric Association recommends, 2 years of breastfeeding.
Because if you take a break, like if you're not doing it 3 times a day,
or every 3 hours,
or every
your
3
milk
hours,
supply can go down.
The body will be like, oh, you don't need it.
Right. It's an effort. So it's like all the things that go into making a healthy baby and pregnancy, those still kind of need to happen. Like she still needs to be getting decent sleep. So having support with the baby at night and figuring that out, how that can work so she can get some chunks of sleep. Having support at work if she has to go back to work. So there's a space that's close by where she can take a break every 3 hours and pump. That's, you know, allowed in our culture, but maybe the work culture where the person's working isn't happening. And then having healthy food to eat, because it's a lot, you know, taking care of a baby takes a lot of time. And so I think the family leave practices now where both the parents can get family leave for at least 12 weeks, sometimes together, or sometimes parents choose to do some tag teaming. But I think that time is just really important because it's a lot of work for somebody to do all by themselves.
How can a partner show up as an all-star dad? Would you say, like, in the term when she's growing the baby, in the moment that she has the baby, and like the few days after that, and then like the first year of the child's life, like how have you seen a man like really rock it and show up?
I think having support for, like I said, like understanding that food and nutrition is really important. So I think cooking is super helpful. Doing cooking, I think in that early time having additional support is really helpful. Like with different ones of my kids, my first grandbaby, my daughter wanted me to live with them for 2 months, but because of my work situation at the time, and there was no way I could have lived with them for 2 months. But I stayed for 2 weeks and helped a lot during that time. So I think having additional help that is focused on the infrastructure, not holding the baby and taking care of the baby, but focused on helping, the couple have some good close bonding time. I think, preparing ahead of time. So I know I said the thing about fresh food, but I do think having some frozen meals and things prepared ahead of time so you can rely on that. Yeah.
Like there's ideals and then there's...
Yeah. And then I think getting up to change the baby's diapers early on. I know a lot of people use disposables or sometimes do like hybrid where they'll use cloth in the day and disposables at night. But even then, there still has to be changing that happens. So kind of letting the parent who's caring for the baby rest as much as they possibly can because they're making the milk, they're attending to the baby primarily. And then I think doing some tag team where, after a feed, say early in the morning, taking the baby, and when the baby was younger, I was doing that quite a bit. I'll do it sometimes where I'll come out, I'll be out here and wearing the baby for a couple hours until she needs to feed again, so that the parent who's primarily taking care of the baby can just sleep solidly, not with the baby next to them, not worrying is the baby going to need something soon? I think supporting a lot of skin-to-skin time. There's been a lot of research on skin-to-skin and in relation to like preemies and things like that, but we all benefit from skin-to-skin connection, and I feel like for baby's development, that's super beneficial. So I think like culturally, if you can support yourself to have like savings, to take time off work, to be able to, if you work at home, it's also easier too, because then you can be doing some work, but also helping with the baby. I think it's more for people who work away from the baby and might be gone for a big chunk of hours. It's just like taking some time off in that early beginning so that there's two people that are taking care. And then if you have more than one child, that's the other factor too, is that it's a lot to take care of, a new baby and little ones too, other little ones. And so I think having extra support around that during that time, because it's, there's something called the fourth trimester, which is kind of that 3 months after the baby's born. And during that time, there's a lot of adjustment and integrating this new little one into the family. And I think by the time you get through that 3 to 4 month period, usually you're kind of integrated more and can be managing things well. But to be able to have to, say the partner goes back to work at 3 days after the baby's born, that's a lot of healing and making breast milk. I mean, the first 6 weeks, getting back to the breast milk, the first 6 weeks of the breastfeeding relationship is building the milk supply for the entire breastfeeding relationship. It's not like the body's later on gonna, build a milk supply. It's really challenging to increase the milk supply after that period of time. So, anyway, that's some of my thoughts about how to support, breastfeeding. I just think, and I think just being present, there's so many hormonal changes that happen throughout the whole pregnancy and afterwards too, that there may be times when it may not totally make sense what they're crying about or what they're feeling or what's going on. And I think just having space to listen and be present, which again, in our culture, there's not necessarily a lot of time for that. But I think that's needed too. So there's some unhappiness by the times.
I got 1 or 2 more questions.
Okay.
But I won't take any more of your time. If a young 20-year-old woman were to come to you and just ask for advice, like she's like, or maybe an 18-year-old, like just graduated high school, like not really sure what she should do with her life. Maybe she wants to have kids, maybe not. Her parents, she's like, great, but not like, oh, I want to be like my mom, or oh, I want to be like my dad. Would you give them any advice on, like, someone that's just like, I don't know what to do with my life?
I mean, I think that, I think the apprenticeship model is a really interesting way to explore different life skills. So if they had the ability, like they had, they didn't have to go start suddenly working full time, and they had some time to start exploring different opportunities and ways of doing things. I mean, that would probably be what I would encourage. I think these foundational skills that we've talked about, I think it's important to build those. So if that was something, they grew up in a family where they there was no cooking that ever happened. You know, just, learning different kind of skills. But I mean, in terms of exploring what you want to do with your life, I think one of the best ways to do that is learning with people who are doing interesting things and just experiment. Like, what's it like to shadow someone, or, you know, I think people can be a lot more open to some of that happening than we might think. Not everybody has that freedom, though, to really be able to explore in that way. College, I think, you know, I did some college, and I think college can be a good experience, but I don't know that it necessarily helps people discover what they want to do with their lives. I mean, I've seen a lot of kids, or a number of them, you know, go to college for something, thinking they want to do something, spending all those years and graduating, and then completely changing their profession right away. Like, it has nothing to do with what they did in college. So, and it's pretty expensive, or, you know, in this country to go to college. So that's kind of can be a challenging thing, that, all this money for something that didn't really meet your need.
All this money to show me that I didn't want to do this.
Yeah.
Yeah.
But I think there's also, you know, people get a lot too from having those kinds of experiences. But I think you can have them in different ways. You know, there's places you can go to work and do things if you have those opportunities to really kind of get to know yourself. I have this, I don't really know, not having grown up in a kind of more integrated situation, but I think, you know, there were more opportunities, I'm imagining, when people lived in a more village style lifestyle, to explore different kinds of jobs and try out different things, like work with people on things and see how that feels. But
that's good.
Yeah.
What are you most proud of?
What am I most? Probably my kids.
Yeah.
It's not easy being a parent, but, you know, it's very rewarding. And it's super fun being a grandparent. It's really fun to, have that experience, not have all the responsibility, but be able to teach them things and play with them and do things. So, yeah, I'd say that's what I'm most proud of.
What are you most excited for? Like in the future of your life?
More time at home, I think. Yeah, I'd like to have more time at home. And I'm still pretty involved with my community as a midwife. Wasn't yet quite ready to stop yet, but I'm getting closer, I think. And then I've studied communication on and off since I was probably in my early 30s, I guess. Like nonviolent communication first, and then I got exposed to this other type of communication, which is called safe conversations now. So I ended up doing this kind of a year-long training in that in 22, I think. But I haven't really had time to put much time into that, and I'm excited to do more with that. I think it's super cool model. I mean, it's a type of communication that was developed by these people that were therapists, like, counselors, or whatever. I don't know all the different.
Sure.
They started a whole type of therapy called imago therapy, and that was how I first learned about about what they were doing, and I started following them. And when they developed a more community-based model, because they wanted to create a model that wasn't therapy-based, so that just anybody could work with together. That's what Safe Conversations is. And it's really, it wasn't originally integrated with brain science, but they realized that it works well with brain science, like how the brain works and how we heal from things, these different foundational pieces of their communication, these sentence stems and stuff. So I like that a lot. I really love that, and I hope to have more time to offer that to my community and stuff. So I'd say that's the two things: being home more, and working, and teaching safe conversations, and having more time with my family, because the midwifery lifestyle is pretty demanding. It's like you can't travel much unless you plan way ahead time off and stuff, and so it makes it harder to visit family that's even just 5 hours away, because because you're on call. So I think, as much as I love my work still, I really, really love working with people at this time of life, and I really enjoy prenatal care a lot. That kind of foundational. Not that I don't like being at people's births and all, but I think my motivation originally was to really support babies in just helping their parents be, as aware and awake and ready for that welcoming of the baby. And the birth is just an aspect of that, and I have a lot of skills in supporting that as well. But I feel like there's so much that can happen in the months that the baby's growing, ways that I can support people learning and making choices and changes that they want to make, but they might not be aware that they want to make them before you start working together. So but it's a lot, and I would like a little more freedom to make choices about my time and stuff. So I'm excited about that.
One more selfish question. You got any constructive feedback on how it can make someone feel more comfortable talking about personal things?
Yeah, probably giving them more of a heads up about what you want to talk about. Not that it's like that's not candid at all, but I think for someone like me who might be more emotional, at times, yeah.
So like you would advise like a phone call before?
I'd probably have some type of pre-conversation, or probably like give them the questions that you might ask ahead of time, just for them to think some about that, like how they might like to answer that, or what that could look like. But I mean, I think you have a nice way about you, and I felt really comfortable, and so it's not like it felt uncomfortable, but
No, that's I like to ask that question. I love constructive criticism. I love criticism. I like people telling me where I didn't show up good. Mm-hmm. Everyone's always telling you did good about this. I'm like, I know, I felt good about that. But a lot of times you don't know whenever you make a mistake and make someone feel uncomfortable. Mm-hmm. So they try to mask it.
Yeah.
To make you feel comfortable. Mm-hmm. So.
Yeah, I feel a little less filtered at the moment, just because of different things I'm working on integrating in my life right now. So. Anyway. Yeah. You got
anything that you'd like to promote or put out there?
Not yet.
All right.
But I definitely, would love to talk more about safe conversations sometimes if that's something that, makes sense. Mm-hmm. In the future. I think it's really amazing, and I love the people that are doing it. I mean, they're in their 80s now, but there's these four conversations, 4 dialogues that you learn in the training, and I think before we would ever do that, I think it'd be really cool to teach those to you, because I think you would have more passion and interest about talking about it if you had some experience of it. So
would you share those 4 things briefly, and then I could do some research on them?
Well, basically it's so you should just look up Safe Conversations online. And then it's basically so Safe Conversations has basically 6 things that you learn, and the number 1 is making an appointment. Like, you learn that rather than just being like your partner comes home from work and you're just like blah. You're like, hey, there's something I really want to talk with you about. Is now a good time? Mm-hmm. And then they can say, no, actually now is really not a good time, and make an appointment with you to talk to them about it. So making an appointment. So you kind of learn that in that. And then the second thing is you always offer an appreciation. So, the appreciation could be anything from like, thank you for making time for this conversation, or, I loved it when you cleaned the kitchen the other night. It felt so good to wake up in the morning and have a clean kitchen to cook. It could be anything, but you offer appreciation. Mm-hmm. And then the next thing after that is that you're sharing what you, the thing that you want to share. And but you're sharing it in such a way that it's not about the other person. So even if it's like,
I feel,
it's a feeling, but it's even more than that. It's de-identified. So, if like when someone leaves all of their clothes all over the floor of the bedroom, it's really hard for me to find my whatever. You always want to de-identify it. And you also learn in this model that because it's a deep listening model, it's a model based on learning to listen deeply to what's being shared. You don't feel like you have to say 500 things about this. You learn how to really concentrate it down to that one thing, and then you summarize. You mirror back first, and then you summarize, and then you empathize, and you validate. So there's all these parts to it that are really important, because what you're wanting to do is show the empathy is just like you're imagining. Well, I imagine that if someone put all their clothes away and the floor was clean, you'd be able to find what you needed really easily, and that would make you feel better. You'd feel better, you'd waste less time, and you kind of imagine how their life might be better if their need was met. And then the validation is just making sense. Like, wow, it totally makes sense to me that it would be easier for you if the clothes weren't on the floor or whatever. So the 4 conversations are with those parts, but the very first one is just an affirmation dialogue. So it's really basically just the first part, where instead of just saying, hey, when you wash dishes, but it's like kind of developing it more deeply, where you're just really affirming your partner. And it's one of the number one dialogues that people practice. It builds a lot of connection, understanding the appreciation, like, the depth of appreciation we have for one another, because a lot of times we don't really offer that. And it's been a while since I've gone through all 4 conversations so to remember exactly what each of the 4 are. But then the next one, I think, is similar to the affirmation dialogue, but it takes you through the entire process. Like the first affirmation dialogue is a little abbreviated. Just goes over certain parts. You make the appointment, you say the appreciation, but then it's a little briefer, because they're just mirroring back what they've said about how they appreciated you. And then the ones that come after those 2, kind of the affirmation and appreciation dialogue, are getting into how you talk about harder stuff together. And they have specific names. One, like the last one, really came out of the therapy model. Because one of the hardest things that I've found to deal with as a human communicator and listener is when you're the problem, right? When someone comes to you and the problem is all about you, because you really need to remove yourself from getting triggered by it and just be present with the pain and wound that this person is in. So to me, the value in safe conversations is when you learn these basics and the way that you can practice them, it's not that hard. Like, you can start out by just like, this week I'm going to practice making appointments with people and have something to talk to them about. And maybe a lot of times people will be available in that moment, but sometimes they won't be. And it's just like understanding how respected that other person feels when you take the time to make an appointment with them to talk to them about something. And then also, so in any case, there's just like little parts you can practice. And so, I would encourage you to do the research if you're interested in going through the dialogues. It doesn't take a lot of time. I mean, I've done it with people on Zoom or on the phone.
Seems like a wise thing to do if you want to have a partner.
I think it's pretty wise. I mean, these people, it was based on years of couples therapy and like understanding what's the biggest, looking for what is the biggest problem in relationship and stuff like that. I think it's super valuable. And for me as a parent, I realized I didn't have that skill. Like, that's why I started studying nonviolent communication. I saw this book in a preschool lending library one time, and I was like, oh, I'll learn about that. And
I think that's huge. Just the appointment making.
It is.
Just being like, hey, I care about you enough that will you set aside time to like actually have an intention to try to work through this, rather than you motherfucker.
Totally.
Tell you. No,
totally. It's definitely, I think it's super valuable. I really believe in it. I think it's, when I first learned it in this therapy model, he found a therapist who used that model, the logotherapy. She wasn't fully trained in it, but, and that's how I got exposed to it. And after I'd studied nonviolent communication at that point for like 10 years. And I was like, yeah, okay, I can see where this goes deeper and how it's even more beneficial. So, not to diss on nonviolent communication, which I think is really valuable. But I love this model, and I was willing to, put the time into learning it more deeply. And and I'm excited about the possibilities with it, but I have to have more time to.
Well, I think that'd be fascinating in the future to do a dialogue just around, more just around relationships. I think that'd be brilliant.
But I'd love to share that with you if you want to learn that. It wouldn't take a lot of time, and it wouldn't have to be all at once. I mean, ideally it'd be like one a week or one every 2 weeks.
Yeah.
Spend about a half an hour going through it, and that's about it. That'd be your time commitment.
Yeah. Let's do it.
Okay, awesome.
Let's do it. Thank you so much for your time.
Yeah, you're so welcome.
I appreciate it.
Yeah.
I usually do a handshake. You want to do that?
Yeah, I can do that. Either one is fine. Yeah.
Thank you.
You're welcome.
I appreciate it.
Yeah.